The vaccines. Why? Well, the Prime Minister has warned a third wave of COVID infection sweeping through Europe will hit the UK.
Previous experience has taught us that when a wave hits our friends, it I'm afraid, washes up on our shores as well. That's why we're getting on with our vaccination programme as fast as we can. But a vaccination campaign, developing vaccines, rolling them out, these are international projects and they require international cooperation.
All the way through this, I've been thinking of Dennis Brown's "No Man is an Island." I tell you for what, because don't know how well we do. If you want to go anywhere, do anything, we have to, deal with what's happening, the lowest common denominator. Boris Johnson stressed the importance of pushing on with the vaccination campaign, though, to try to limit the impact of more infections. Still a dispute, as you know, over COVID vaccine supplies to and from the EU, and Boris Johnson is expected to speak to EU leaders this week. Meanwhile, here in the UK, half of all adults have now had their first dose of the COVID vaccine, and some are about to get their second. Our reporter Anna O'Neill is in Camden for us. Not for the first time, Anna.
No, not for the first time, but in a different location. So I was lucky enough to be invited to the Bloomsbury Health Centre, where adults were getting they were actually over 80s and over 70s at the time. Back in December, they were getting their first jabs of the Pfizer vaccine that had just arrived, sort of pretty much that day when I got there. This time I'm in Swiss Cottage, still in Camden, still part of the Camden Primary Care Network. They've invited me back again, this time to see the second jabs. And this time adults have been getting their AstraZeneca second jabs, Eddie. So
right,
there we go. It's been a very exciting day.
Well, you imagine so, because I suppose the first time we wouldn't have been talking about what dose it was. I imagine that people are asking. We'll get to that. So in terms of busyness, just describe it for me, Anna, compared to last time. I know it's a different place, but...
It's a different place, and guess what? It's not busy at all because they've just finished their very last vaccine of the day. Don't worry though, Eddie, I was there to see it. I'm standing outside the Green Light Pharmacy and Travel Clinic, which is in Swiss Cottage, and outside that is a very small porter cabin, and that's where people have been coming into all afternoon. I think they just finished the last one just before we came on air, actually, Eddie. But I've managed to speak to some of the people who were getting their second doses today, and Arthur Max and his wife Ruth Renbaum, they were getting theirs today. Well, actually, his wife was getting hers tomorrow, but she was accompanying her husband today. And they told me how they felt today. Have a listen.
My name is Arthur Max, and I've just had my second jab, and I'm very happy to have it. The first time around, I had some joint ache for one day, and my wife complained that I was a bit crabby for a couple of days. Other than that, it was nothing. I'm looking so much forward to getting back to getting on a bus. Can you believe it? Never mind the tube, and just like going into town. It's been a year since we've been really out of the neighborhood.
Now, shall we speak to your lovely wife?
Please do.
Tell me who you are, please, lovely wife.
My name is Ruth Renbaum, and we moved to England about 7-8 years ago. But we really miss all the things that London stands for, and we hope that we'll be able to get back into our lives. And I told Aunt the day we walk across the bridge towards the National Theatre and sit in a seat, I think I won't be able to see the stage because I'll be crying. But we're thrilled that we've been able to, get the shots.
I just got our producer Lauren here, Anna, to wangle me a couple of tickets to Hamilton the last time all of this happened. So as a lovey, me and Joe will be anywhere they need to be. Now, just one second before we move on, I dressed up to go to mine, and lots of people I know. But have you seen the pictures of the Conservative MPs who've taken their shirts off today, Anna?
No, I haven't.
I wish I'd done that.
I want to. I'm not sure I want to see that, Eddie. Too much for my eyes.
Absolutely. Well, look, we got to that number, didn't we? 840-odd thousand yesterday. The numbers on my phone now are, heartening. My sympathy, of course, goes to anybody who's passed away. But I think the number today was down to 33 or something, COVID-related deaths. Now, how is it going down? I mean, give us an idea in terms of AstraZeneca, what people are saying.
Yeah, well, I've been asking them that because, of course, there has been a little bit of controversy, hasn't there, over the past few weeks because, of course, some countries in Europe, I think it was 17 countries in Europe, for a while temporarily suspended the AstraZeneca vaccine because they were worried about blood clots. Now, that's been said to be there are no more blood clots than there would be in the general population. In fact, I've heard there are fewer blood clots among the people that have had the AstraZeneca vaccine than in the general population. But, you know, sometimes these things start people off worrying, don't they? And I know that your next guest is going to be able to tell you a lot more about that from a practical point of view down at the GP surgery. But in terms of, has it put people off? Well, no, because when I was here, a lady turned up on spec to find out whether she could possibly have it. And she wasn't the first that day. Apparently, there's been at least 3 people that have been asking the same thing. This is Manuela.
If, for example, we've been trying to call, no one's coming in, and we've got, it's getting dark, for example, we don't like wasting doses, we might be able to give one then. But for now, especially with the second doses, as it's very highly unlikely that you'll be able to get a spare dose here today.
Yeah. That makes sense.
You just came up and you said, have you any chance of getting a vaccine?
Yeah, I really look forward to getting my vaccine. I'm just a normal professional in my 40s. And,
so you've got a while yet to wait?
Yeah, I was hoping to get one in April, but it doesn't seem that is happening now. So I just thought maybe if I show up and they have an extra, not at this time, but maybe later in the day.
It's amazing, Anna. So come on, then. We're talking vaccines. You and I are real people.
Yeah.
We make a big deal of that. Don't look like we're going to get a holiday this year, Anna.
Do you know what? I was thinking the same thing. My husband, by the way, had his vaccine yesterday. He was a bit, he was a bit worried. I could tell he was a little bit like, oh, should I? I said, of course you should. Definitely. And I actually booked it for him, Eddie. I gave him no choice.
I was going to say he had a lot of choice then, did he?
Yeah, but you know what? He didn't have any side effects whatsoever. My son was lucky enough, after we spoke about asthma and the fact that asthmatics were taken off that tier 6 that they were meant to be on a few weeks ago. But just after we did that programme, the next day, my son's GP surgery called to say that he could have the vaccine. So I think we were talking about it at the time, weren't we, about whether it's dependent on GP practices, about whether they remove some of the asthmatics from there. Fortunately, my son wasn't removed, so we've now got 2 people in the family who've had their first dose of the vaccine. I, of course, Eddie, am far too young to have the vaccine yet.
No,
a bit like you.
I think he just had it, said he had an excuse to isolate from you, Anna. Thanks.
Possibly.
Thank you
that
very
might
much.
be the case.
Take it easy, Anna. We'll talk again very soon. Our intrepid reporter, Anna Renil, there for Raj Gill is physician associate partner in general practice for the Central Camden Primary Care Network. Raj, thanks so much for your time.
Good evening, Eddie.
I mean, I'm tempted to start with America. I could go to Europe, but let's start on our own backyard. This is a London radio station. You have a centre in London delivering much-needed vaccines to the people of our capital city. Are they asking you generally about whether they're having one or the other, and do they seem to care?
Well, we are getting a lot of queries. So we're getting queries before people come for their appointments. So when they're booking in, they're asking lots of questions about which vaccines we're giving. Often when they actually come in, we're spending a lot more time with people talking about any risks that there might be, side effects. And even though now these vaccines have been approved in Europe and the countries that had temporarily suspended them are now using them again, both in the UK and the European Medicines Associations have said vaccine's safe, there's no risk of blood clots, you should go ahead and have it. We're still getting queries, and I think that message hasn't fully filtered through to people, and we're still getting the same queries.
Mm-hmm. I mean, if it's bad here, imagine what it's like in Germany, France, Poland, where they did actually suspend it. And I know the French, but by nature, apparently, are not particularly keen on vaccines. I mean, talking about what's happening across Europe and making light of going on holiday, it probably mentally is a big part of what lots and lots of people look forward to, Doctor.
I think it's one of the things that are encouraging people to step forward and have the vaccination. So where they'd maybe previously been a bit hesitant, as more and more people are now having the vaccine, I think it's instilling some confidence. And when they're hearing things like vaccine passport, that's a query we get every day virtually. Is this my vaccine passport? Can I go on holiday now? We say not quite yet. So, you need to follow the guidance. Don't be booking anything straight away. We're still in a travel ban as well. But, it's those things that people are looking forward to, just like in the audio there. People are looking forward to getting back to normal life. And so I think that's sometimes the push to get them across the line and to have the vaccine.
I think I'm pragmatic. My mum and my wife just say I'm miserable. So when I hear the Prime Minister warning about a third wave, sickness doesn't discriminate, and there are no borders when it comes to this virus in this way. It is difficult to see, even though we are an island, how if Europe is perhaps going into a third wave, no matter how many of us have had it, we're still at risk, aren't we, surely?
I think obviously our risk is going to be there still, and as we've seen in the previous waves, whatever's happening in Europe often follows through into the UK afterwards. But where we're in a much better position than we were before is we're enacting a plan which is going to help prevent both the spread of the vaccine as well as protect people from getting seriously ill and ending up in hospital and overwhelming the NHS. And if you think about where we're at, more than 50% of our adult population has been vaccinated now. If we can keep that momentum up and maintain our social distancing and mask wearing and all the other measures that need to go in place, the two in tandem could prevent a third wave.
And it is could, isn't it? It's not would. It is a could, isn't it? It's not a would.
It is a could, and I think time will tell, and we'll have to see how things go. But we are so much further ahead with our vaccine programme than anywhere else in Europe. And I know there's been a few stumbling blocks. There's been some queries about the vaccine. All of that's gone now. We just need to keep maintaining it. If we can get the supply of vaccine, what we know we're good at in the UK is all the GP sites up and down the country have been vaccinating. And this is how we've got to such a high level. And if we can maintain that, and we're starting our second doses now, this will make a significant dent in that.
Well, let's end on that second dose, because it seemed to me that the government were on the back foot last week in talking about shortages, not being able to quite do it in the way they wanted, although still hitting all the targets. Where are we with the second dose?
So I think this is a big query that we're getting, and I think this is a message that I'd like to get out there, that actually people that have had the first dose, we allocated the second one ready to them. So actually what we're aware of is that the supply chain is good for second doses. So all our highest risk patients were the first to receive the vaccine, and they're the ones that we're now inviting for the second doses and are getting it. And we've got the vaccines for those. Where we haven't got necessarily such a good supply chain is to move down to the younger patients without any health conditions. They're arguably at a slightly lower risk anyway, and actually we should probably be working towards getting our most highest risk patients vaccinated first. And that's, where it's gone against really the government schedule, and we were very ahead of the schedule. But actually what we can be sure of, and I think you can reassure your listeners that there is a vaccine if you're due a second dose. Don't worry, you don't need to be contacting your GP practice. You will be contacted when you're due to have it, and that supply chain is in place.
So I'm asking for a mate, yeah? It's not me, because I'm hugely articulate and highly intelligent. I would never ask such a silly question. So this is from my mate, yeah? How is the second dose different? Is it just the top up of the first one? Is it configured differently? In layperson's terms?
It's exactly the same vaccination, but what you're having is a reinforcement dose
of the same one, right?
Immunity. Okay. And how the government have arranged it is we had good suppliers of the Pfizer vaccine at the beginning. That's tailing off now, so we don't really have that so much for second.
But theoretically, Doctor, just theoretically, right? Just indulge me for a second. If we're getting up to, last week I read up to 85% protection, and theoretically, following the argument through, wouldn't it be better to give everybody one dose?
Well, I think we've got to think about who we're vaccinating. So we started the programme with those that are going to be at the highest risk.
Yes.
And these are the people that are more likely to end up in hospital. And actually, you want to give those people the maximum amount of protection. And actually, say if one dose is 70%, 75%, if you can get that to 95%, that's a person you're going to keep out of hospital. You're going to protect them. You're going to help the NHS by not overwhelming it. And this is kind of, it's a bigger picture than just
Right. No, I understand.
Individual
I
risk.
understand. I get asked questions, and it's great to have somebody who actually knows what they're talking about to answer them, as opposed to me blagging them. Here is one area you may have to blag, though. I'm trying to build up a little list. I hope you don't mind me asking you this, Raj, of terms, words, sentences that perhaps wouldn't have made any sense a year ago, but absolutely the name of something. What have you learned? Give me something that you're saying now that you may not have said over a year ago. And don't say AstraZeneca, please, because that would be
that was going to be my first.
that would be cheating.
Okay, so if that's not cheating, something we found out from sort of our patients and staff is the word furlough. I'd never heard of that before. I found out the meaning of it during this pandemic. So that would be my word.
We all looked it up. We were all thinking it was furlong, as in horse racing or something.
Horse racing.
Well done. That's exactly the type of answer I wanted. Thank you very much for letting Anna in, and hopefully she didn't make a mess and cause too much of a nuisance of herself. There you go. A hub here in London where the second dose is being given. Really important. 800,000 or so. 33 deaths only, and each and one of those is an absolute tragedy. But I've sat here where they were up, in the four figures, and it isn't nice either. So we are at a place. Any vaccination story, whether you've taken your top, that ridiculous. Have you seen that? Have a look at those pictures if you haven't seen them. People taking their tops off to get vaccinated, and then come on, pick up the phone, give us a call. 0800 731 2000. Also looking for those terms that perhaps we're using, words. It could